Hi there, Andrew Zang, Physical Therapy here, and today I want to share some more thoughts on spinal stenosis because I wrote an article on it the other day and I've gotten some feedback and some questions, so I want to jump on and answer them. So spinal stenosis is basically a narrowing of the spinal canal. It is something that, yes, does happen with age, but age doesn't necessarily mean you are going to have this condition. Sometimes it can come a result of just years of hard work and just life. So there's not always a great answer. But basically the narrowing the spinal canal results in a little bit of compression on the various spinal nerves, most often when people are standing and walking and trying to be active. And so what these people may experience, it could be back pain, it could be leg pain, or it could be both. Okay, a lot of people, they notice the leg pain, not so much the back pain. So as they get up and they walk, they have a distance that they can go, and then they'll start to get either pain in their legs, heaviness, could be numbness or tingling or something like that. And oftentimes once they sit, their pain will go away, and usually very quickly. So these folks tend to adopt that posture and position, sitting. They don't want to get up and walk to go do things recreationally. They don't want to go to the store, go out with friends, go on vacation, because they know it makes their legs hurt and tingle, and they know when they sit they get better. So little by little the endurance and the tolerance for walking gets less, and this is a vicious cycle. So people don't want to hurt, so they do what makes them feel better, and it leads to nothing but less function, less ability to go do what you want to do. So the question is, how do we treat this, and how can we advance life so that we can be more active and enjoy it? And that answer it involves a little bit of discomfort along the way, and that discomfort is you got to walk. You have to get up. You have to recondition yourself. Yes, you may experience some numbness or tingling or heaviness or some pain in your legs, but when you sit, you know it goes away. So get up and move is first and foremost. This movement is going to stimulate blood flow through those spinal nerves, through all those muscles that help you walk. Okay, that's going to loosen them up and help them not be so stiff. Oftentimes people with stenosis tend to be stiff, and they sit more, so they get stiffer, and it's a vicious cycle. So getting up and moving is hugely helpful to recondition the muscles to keep yourself loose and active. Another key important piece is flexibility. One of the lower spine, and there are some very simple range of motion exercises that you can do in your home, as well as, and this is the key thing, stretching out your hip joints. And every time I talk to people who have back pain, they ask, why are you stretching out my hips? And the answer is, there's a close relationship between your hip joints and your spine when you walk. So if you don't have enough motion in your hip joints, and extension in particular, when the leg goes behind you, that's going to then transmit greater stress up into the lower back. And if that's where your problem is, it's going to exacerbate what you feel. So improving the flexibility through your hip joints as well as the strength is hugely, hugely helpful. I can't tell you the number of individuals that I've worked with who have had it doesn't even have to be spinal stenosis. It could just be back pain in general. And when you loosen up their hip joints, they feel markedly better. So that is a very key thing. If you are somebody who just has back pain, and especially if you have spinal stenosis, you need to get up and move, and you got to work on that flexibility. Those are the two most important things. And if you're looking for somebody to guide you, then contact your physician, contact someone like me, a physical therapist. We can help guide you into the best exercises and best stretches for you. Again, a lot of this stuff can be done at home, so it's not like you necessarily need to see someone like me for tons and tons of visits. You just need guidance so you know what to do, and you know what is a normal response and how to progress things and move better with it. Because you can move better. The only reason to not move better is because you're not willing to get up off of that chair and go for a walk. So that is my challenge to anybody out there who has back pain or has spinal stenosis. Get up and move. It is the number one thing to reduce those aches and pains and help you to feel better. Even if you may feel a little bit sore as you start, the more you move, the better you're going to feel. The more you sit, the worse you're going to feel. So get up and move. And by all means, if you need some help, shoot me an email, andrew@zangpt.com. Put something in the chat bar. I will respond to you either way. Or pick up the phone and call whatever healthcare provider you've been using, who you trust and who has helped you before. So I hope this message is helpful for those who have spinal stenosis or have back pain. But I want you to take action, get moving, and feel better. Have a nice day.